Today we have something special for the weekend. If it looks like I never change my clothes, it's because I'm wearing my coat, and I do a lot of these videos in my car, so I apologize. I'm also distracted, as when one is in their car, they need to watch what's going on. I wanted to address one or two concerns that I am not diversified. So if you would like, you can follow me on Strava, my exercise app, and you can follow me on Peloton. I am a very athletic person, and as an age grouper, am in probably the top 5 or 10% in swimming and cycling in the country. Okay, so I wanted to discuss, what does a rheumatologist do? Most people associate rheumatologists with treating rheumatoid arthritis, and we do. However, there's a lot of things where there's confusion between orthopedics and rheumatology. An orthopedic surgeon is a bone surgeon, that's why they're called orthopedic surgeons, and a rheumatologist is a bone doctor. Other than the obvious things we treat, which may not be obvious to the general public, you should be seeing your rheumatologist for rheumatoid arthritis, osteoarthritis, psoriatic arthritis, ankylosing spondylitis, any type of joint pain, swelling, tenderness, inflammation. In addition, you should be seeing a rheumatologist for bone loss, osteoporosis, evaluation of bone loss and osteoporosis, and treatment of same. Now, the part where there seems to be confusion and overlap I'm referring mostly to joint pain, and I'll give you an example of why, for example, shoulder pain should be treated by a rheumatologist. A non-surgical problem should be treated by a bone doctor, not a bone surgeon. And the rheumatic manifestations of diabetes start in the rotator cuff and go down to the Charcot foot, which is a collapse of the foot, and can involve the carpal tunnel, the trigger fingers, and all the things that a rheumatologist will inject successfully, and therefore will not require the services of a surgeon of any type. Not a plastic, nor an orthopedic, nor a hand surgeon. So, if you have hand pain, if you have carpal tunnel, which is often manifested by pain, weakness, and numbness in the thumb in that region, if you have a finger that locks, such as this, a locking or a trigger finger, these are things that we as a rheumatologist do. If you have wrist pain, and the wrist pain would be right about at the base of the thumb, let's see, okay, right there, that type of pain causes weakness, trouble with grip, trouble turning doorknobs, handles, jars. That is for your rheumatologist to take care of. Elbow pain, tennis elbow, golfer's elbow, tendinitis of the elbow, swelling on the back of the elbow that looks like a golf ball, shoulder pain, shoulder tendinitis, bursitis, rotator cuff, hip pain, clicking, snapping, bursitis of the hip, bursitis of the lower back, osteoarthritis and low back pain, knee bursitis, knee arthritis, chondromalacia patelli. These are all things treated by the rheumatologist, diagnosed by history, blood work, x-ray, examination, and so on. Foot and ankle, we treat heel spur pain, which is actually called plantar fasciitis. We look at Achilles swelling and we feel it, and we diagnose a seronegative spondyloarthropathy, i.e. somebody like Larry Bird, who had a basketball career ended by psoriatic arthritis and not diagnosed until after he had already lost his career and was diagnosed later by a rheumatologist. So I hope this sheds light on what a rheumatologist does on a day-to-day basis. Yes, we do diagnose and treat rheumatoid arthritis. Yes, we do prescribe and administer intravenous or subcutaneous medication, state-of-the-art. Yes, we do treat gout, and we take all forms of gout, the worst and the most moderate. If you're treated correctly for gout, you should not get an attack again. If you're treated correctly for psoriatic arthritis, particularly with the new available injectable medications called biologics, similar for rheumatoid arthritis, you should do very well. When I was in training years ago, a third of rheumatoid arthritis patients would allegedly get crippled. Now, you don't even hear of this. So, if you have any questions, please ask me. I'll be happy to address them on the next video. Thank you and have a nice weekend.